Today, let's look at the epidural injection, the most common and most helpful injection for pain that's coming from your neck or back. When you are advised to get an epidural injection, it is because a nerve or nerves coming out of your spine are irritated. This could be due to a disc bulge, herniation, disc rupture, degenerative disc disease, arthritis, stenosis, a tear in the disc wall, bone spurs called osteophytes, or from scar tissue from a prior spinal surgery. These irritations could be in your neck, your mid-back, or your low back. Most of the time, these irritations are very apparent on an MRI, but sometimes they're not. Epidural injections are also known by a couple of other names, such as spinal block, nerve block, or nerve root block. Generally speaking, they all mean about the same thing. Let's take a look at where the injection is placed. This is a cross-section of your spine with your disc here, the spinal cord here. This yellow area is the epidural space, and the green are the nerves coming out of your spine. This epidural space is the same space where we put epidural catheters for women that are in labor. As you can see, this space is roughly a circle. Now, any medication put in this space needs to have its effect here and over on this side as well for pain on the opposite side of the body. And you can get medication there two ways: by giving an injection through the midline or an injection called the transforaminal. What's the difference? Well, sometimes quite a lot. With the midline approach, we rely on the medication traveling around this curve to get to the target areas. But it's hard to control which way the medication goes or how much medication goes to each side. That's why some mothers report that they were more numb on one side of their body during labor. It's because a catheter was put in here and it was slightly off center. For disc problems like sciatica, the midline epidural is the most common way to do it, but we have the same problem ensuring the medication reaches the target area. So in most cases, a transforaminal epidural is the best way to ensure the medication reaches the target area, particularly for pain that is mostly or completely on one side of your body. So when you need an epidural done, ask your doctor which technique he or she will be doing. This image roughly indicates the area of the body where your spinal nerves go. You can see, for example, that pinched nerve pain running across your hip, your outside of your thigh, the front of your knee, inside of your leg to your big toe is most likely due to your L4 nerve getting pinched, and pain coming out of your neck across your shoulder and down to your thumb is most likely due to your C6 nerve. Thanks for listening. If you'd like to know if you're a candidate for an epidural injection, whether it's using steroid medication or a breakthrough product called platelet-rich plasma that comes from your own body, we would be happy to review your specific situation and meet with you in person. No referral is necessary, and we accept most insurances. If you don't have insurance, or if you have a high deductible, or if your insurance has denied the treatment you need, we have the most affordable self-pay rates for injections in Charleston.